think when you approach a chronic pain patient, regardless of what they have, you have to look at them as any other patient. So we can call them a hypertensive patient, or we could call them a diabetic patient, or we can call them a patient who has lung problems, or a patient who has kidney problems. Anytime you have any patient with any type of problem, we always look at the patient as a whole and we say, hey, how can we treat the patient as a whole by addressing that disease? But for some reason, when the patient has chronic pain, we still have a lot of providers that, oh my gosh, now I don't treat chronic pain. And that's a big problem. Or they may say, well, we treat chronic pain, here's a pill to treat your chronic pain. I appreciate the fact that they're trying to help, but you're ignoring a lot of different issues when you do that, and potentially creating more issues. One of those things that we see quite often is the lack of addressing sleep as a comorbid condition in chronic pain. And it's kind of that classic chicken or the egg, which came first. Really, which came first? It's sometimes very tough to know which came first. Is it the sleep disturbance that came first or the chronic pain that came first? And they both feed into each other. And here's what happens when you have sleep disturbances and when you have chronic pain. You can also develop central sensitization issues. And what happens then is you get the neurophysiologic changes, which then augment your pain, which then cause more sleep disturbances, or vice versa. The sleep disturbances augment the neuropathic changes or the central sensitization changes, which cause an increase in chronic pain. We have to try to stop that, and the only way to try to stop that is by addressing both. To address both, you have to ask questions about both. Unless you ask questions, you can't address either problem. So I think that can be done in the primary care setting, that can be done really in any setting. When you see a patient who has chronic pain, you have to address their sleep. You have to ask them, how is your sleep? Beyond that, you can do testing to assess their sleep. But beyond that, what do you do? I think it's a grave mistake to put them on hypnotic medications. Those hypnotic medications rob the patient of their own ability to sleep, and those hypnotic medications rob the patient from restorative sleep. Those are two incredibly fundamental things that the patient needs in order to recover, to feel better, to get restful sleep so they can be energized the next day. When you have non-restful sleep, it causes a whole host of medical complications, which we won't get into right now, but most physicians know what they are. So address the problem, not by making it worse, but address the problem with treatment options that can actually improve the patient's sleep and hopefully reduce their pain.